Hello and welcome. Today we'll be discussing a rare but serious genetic condition called vascular Ehlers-Danlos syndrome, or VEDS. We'll explore how this condition impacts the heart and blood vessels, and what can be done to manage it. VEDS is primarily caused by a mutation in the CAL3-1 gene. This gene provides instructions for making type I procollagen, a protein vital for the structure and strength of many tissues, especially in blood vessels, skin, and internal organs. When the gene is mutated, the body produces faulty or insufficient type I procollagen. This weakens these tissues, making them prone to rupture or dissection. The weakened connective tissue in VEDS leads to a variety of problems, particularly within the cardiovascular system. The walls of arteries become fragile and susceptible to aneurysms, which are bulges in the vessel wall, and dissections, which are tears in the vessel wall. These can lead to life-threatening bleeding. The intestines and uterus can also be affected, making them prone to rupture as well. The lack of strong collagen fibers results in less resistance to blood pressure and other forms of mechanical stress. Vascular Ehlers syndrome is a rare condition, estimated to affect about 1 in 50,000 to 1 in 200,000 individuals. It affects people of all ethnicities and geographic locations equally. Because it's a genetic condition, it is inherited in an autosomal dominant pattern, meaning that only one copy of the mutated gene is sufficient to cause the disorder. Therefore, an affected parent has a 50% chance of passing the gene onto their child. The signs and symptoms of VEDS can vary from person to person, but common features include thin, translucent skin with visible veins, especially on the chest and abdomen. Individuals may bruise easily and have characteristic facial features like a thin nose, lobeless ears, and small chin. Joint hypermobility, particularly in the small joints, is often present, though less pronounced than in other types of Ehlers-Danlos syndrome. However, the most serious manifestations are related to vascular complications, such as arterial rupture or dissection, which can present as sudden and severe pain. Organ rupture, such as a ruptured bowel or uterus, can also occur. Diagnosing VEDS can be challenging due to its rarity and variable presentation. Suspicion usually arises based on physical findings and medical history, especially a family history of VEDS or sudden unexplained death. The gold standard for diagnosis is genetic testing to identify a mutation in the CAL3A1 gene. In cases where genetic testing is inconclusive, a skin biopsy can be performed to analyze the structure of type I collagen. Vascular imaging, such as CT angiography or MRI angiography, is often used to assess the condition of the blood vessels and look for aneurysms or dissections. While there are no specific subtypes for vascular EDS, there are different mutations in the CAL3A1 gene, which may lead to variations in the severity and presentation of the symptoms. Unfortunately, there is no cure for VEDS. Treatment focuses on preventing life-threatening complications and managing symptoms. Regular monitoring of the blood vessels with imaging is crucial to detect aneurysms or dissections early. Elective surgery to repair aneurysms may be considered, but the risk of complications is high due to the fragility of the tissues. Medications, such as beta blockers, may be used to lower blood pressure and reduce stress on the blood vessels. Patients are advised to avoid activities that could increase the risk of injury, such as contact sports or heavy lifting. Genetic counseling is also recommended for individuals and families affected by VEDS. Currently, there is no known way to prevent VEDS as it is a genetic condition. Genetic counseling is crucial for family planning. Prenatal testing, such as amniocentesis or chorionic villus sampling, can be performed to determine if a fetus has inherited the CAL3A1 mutation if there is a known family history of VEDS. The prognosis for individuals with VEDS can be guarded. The risk of arterial rupture or dissection is significant, and these events can be fatal. However, with careful management, regular monitoring, and proactive intervention, some individuals can live longer and healthier lives. Recent research is focused on developing new therapies to strengthen blood vessels and reduce the risk of complications. Some studies are exploring the potential of medications that inhibit certain enzymes involved in collagen degradation. Early detection and comprehensive care remain the cornerstones of improving outcomes for those affected by this challenging condition.